Alrighty, let's go ahead and get this webinar started. Going to introduce Jesse Brewer. He's the representative for SureBridge. He's the sales director, and he's going to talk to you a little bit about SureBridge and the voluntary benefits market. So Jesse, take it away.
All right, good morning. Thank you. I sure appreciate the opportunity to work with all the agents that work with Messer Financial. I've known Roy and Bill for a long time and appreciate all they do for the industry and promoting our products. They do a great job. So again, thank you very much. Today's webinar, we're going to talk a little bit about SureBridge and the voluntary benefits market. And when we look at the voluntary benefits market, there's a lot of different names for it. And so really, what is list bill? Well, list bill is a worksite functionality which will help facilitate sales policies at the worksite, allow you to collect one billing from the employer. So you're selling insurance at the place of work. They're going to deduct the money out of the employee's check, and the employer's going to send one check to us. So that's a great way for employees to be able to purchase coverage to help fill the gaps. Now, all the products that we have available on the supplemental side can be put on list bill. Now, we will not put the Get Well on list bill, but all the other products you can put on list bill. Now, this is not employer-sponsored insurance or anything else. It's just that the employer is going to facilitate the payment mechanism of being able to purchase insurance. So why does this make sense? I've been doing a lot of reading now that we've had the pandemic, and I'm not in my basement like the gentleman is up in Delaware, but I am in my office in Nebraska, and we're doing our social distancing and everything else. But you end up doing a lot of reading and studying and a lot of webinars and Zoom meetings, but you find out a lot of stuff. And this was a survey or a study that was done by SureBridge. And I found this very interesting with the numbers that they had. 41% would purchase insurance products to cover exposure and deductibles. Well, a lot of people have gone out and purchased high deductible plans, and yet we know that many people do not have the ability to cover that exposure if something would happen. Because we know that 2/3 of the population don't have the ability to cover a $1,000 emergency. And now with COVID and everything else, it was probably a little bit higher. So 41%, they would purchase, if they could at work, products that would fill those gaps. Now, 76% of those people would like to pay for the insurance products through payroll deduction. Well, what happens? Most people have a tendency to live on what they take home. Their budget seems to match exactly what they take home. But for a lot of people, the month is about 1 week too long when they start thinking about the amount of money they have and the bills that they have. So 76% would like to pay for it through payroll deduction. So you have, they like to purchase it, they like to pay for it, and now they'd like to have face-to-face meetings. Well, that's 2/3 of 65%. That's a little tough right now with social distancing, but with SureBridge, you have the ability to do meetings online, through Zoom or whatever, and contact all the employees of that employer group and do it all electronically. And I know you can do that through Messer Financial with their quote tool that they have, an apply tool. Now, our mission here at SureBridge is we consistently provide the most convenient way to obtain the best protection at the best price. We're doing list bill. We do credit card, we do direct bill, all different types. But today we want to talk about list bill. Brand promise, choice, plus convenience, plus counsel. In other words, we want to be that trusted advisor. We're supporting that employer and wanting to take care of his employees to make sure that they become sick or hurt or life throws a little twists and turns, that they're going to be able to be covered. Now, as a company, we were purchased by United Healthcare, UH1, here about 1.5 years ago. And so now our ratings, we're A+. So we've got, the backing of United Healthcare behind us. with SureBridge and Chesapeake Life. So going forward, we have choice. In other words, you have a choice of all the different products that we have, and you can get those for you or your family members and customize the plan. Convenience, it's all done, online, electronic apps, great way to purchase coverage and counsel. You can do that with the trusted advisor. Now, small business market, you as an agent, why should you focus on your selling efforts in the small business market? Well, I know that open enrollment hasn't started yet, but that's around the corner. But there's a few more months of the year instead of just open enrollment that you can be working and making additional sales. So why do you want to focus on the small business market? There's an opportunity there for good quality business. You're dealing with people who are employed, so the premiums are going to be paid. They're going to stay on the books, and you're going to be able to get your renewals. Quick and easy electronic app. You're going to find out that about 97, 98% of our cases are issued same day because we have knockout questions. And if not, then we have the simplified or guaranteed issue, very limited underwriting. So if they can't qualify for the max amount that they want due to the medications or something that they're on, at least they can get the guaranteed issue amount. And like I said, it can be sold year round. You don't have to be involved in OEP, anything like that. And this is going to be plans that are going to supplement their current, usually high deductible health plans, HSA, flexible spending accounts. Now, small businesses, 30.2 million small businesses in the United States. That was before the pandemic, so it's going to be a little less now. 99.9% of US businesses are small. 58.9 million employees and 47.5% of US employees. So it makes up almost 50% of our people that are employed out there working. So the small business market, we want to tap into that. Good opportunity there. Now, where we like to focus is firms with fewer than 100 workers account for 98% of businesses. We're not going to be talking to Google and, Marriott and Amazon and Apple. We're going to be talking to ABC Hardwood, Joe's Electric, Brandon's HVAC company, Julie's Hairstyling, those types of businesses. Firms with fewer than 20 employees account for 89% of businesses. So great time to go talk to these people. But what also we found out is that when we did over the study that I was reading, that the market is untapped. And we really want to focus on this 2 to 9 and 10 to 24 because at SureBridge, you're going to find our average list fill case runs right around 7 lives. So that's a pretty good deal. 7 lives, and people are spending, anywhere from $30 to $90 a month payroll deduction, depending on the plan. So that can be a significant amount of premium. But if you look at 2 to 9, 10 to 24, dental insurance, 18%. Okay. So you got 1 out of 5. You got almost 82% of the market still left that doesn't have dental insurance. Vision, 83% left. Critical illness, accident, and disability. And then on the 10 to 24, they offer a little bit more than the 2 to 9, the small employers, the real small employers, but the 10 to 24, they have usually a more robust package of benefits and things. Whereas when you look at the 100 plus, they offer all those products. So going forward, look at that opportunity that we have on these 10 to 24 and 2 to 9 size groups. Well, why should an employer offer voluntary benefits? Well, it helps with employee retention and recruitment. There's been a lot of business owners I've talked to in the past that many times they've lost a key employee that worked for them. And a lot of times that key employee went out and opened up a business just like them and started to recruit their major accounts and things. So You want to keep these people happy and give them the opportunity to purchase coverage. So it's going to help with the retention and recruitment. There's little or no cost to the company. There might be some admin cost when they have to call the payroll company to adjust deductions or something like that, but it's going to be minimal. And they're getting good benefits, policies that'll cover those gaps, accidents. Not all accidents happen at work to where they would be paid workers' comp, but many of them happen at home. And so how are they going to get to work? So I kind of look at all of our products as being, income replacement. And you can customize it. Maybe not everybody wants to have 50,000 critical. Somebody might want 10. Somebody might want to insure children. Somebody, so you can pick and choose what you want to do. So you can protect the employees. Now, why should employees purchase? Well, it's easy. Provides financial security. I'm getting products that's going to protect me in the time if something would happen. It helps pay out-of-pocket costs. Well, all the benefits are being paid directly to me, and I can decide on how to pay them. There's no coordination of benefits with the hospital or anything like that. The money comes to me, and I can pay those, the doctors and the hospitals. I can do all that. Convenient process, it's strictly through payroll. It works that way. And some benefits are available immediately, the accident plans and things, and may result in healthier lives. Because when we look at certain benefits, kind of look at products that focus on wellness. Now, as an agent, one prospect turns into many. You might sell one of the employees coverage. They might be calling you and say, you know what? I have some grandparents. They need some counseling about a med sub. Would you be able to help them? I don't see a problem with that. So you're going to be able to get more prospects to talk to. And right now, I know that generating leads is tough. And also, if you're purchasing leads, sometimes they can be pretty expensive and they might not be as good as you thought. And I know that Messer Financial does a good job with helping agents develop lead programs and things like that. So that's good. You interact with small businesses daily. You are talking to small business owners all the time. You're going to the grocery store, you're going to the hardware store, you're having something done at your home, the carpenter, people like that. In fact, right now I have a carpentry project going on in our house. And so I have a carpenter over here. He'll be here for the next 2 days getting this project done. So if I was able to sell, I'd be talking to him about coverage. And you don't have to have their core product. In other words, you can buy your major med from somewhere else, but you can buy all the other products with us. So good deal. Now, why should you use SureBridge List Bill? When you do that, there's no application fee, and there's only 2 lives are required. Many payroll deduction companies require like 5 lives, something like that, or participation requirements. We don't have that. 2 lives, employer, employee. So we have a lot of list bill cases for churches because we'll have the secretary and the minister, maybe the choir director, the organist, if they have full-time employment there. So that works out well. And like I said, simplified or guaranteed issue. Products are portable. You can customize it. You can do it for the entire family, and everything's electronic. So it's really state of the art. Very, very good point of sales tool. Now, when I look at the product portfolio for SureBridge, I kind of break it into 2 major categories. The first one is income replacement. In other words, all that money is being paid directly to you, and you decide what to do with it. There's no coordination of benefits, like I said. So you got HospitalWise, accident companion, critical illness, disability income, accident or illness. So you've got all those products that's going to pay you directly. Now the wellness focus, and when we remember that chart that we have the prime DVH, dental, vision, hearing. We also have a standalone dental, and we also have a standalone vision. So you can get them all in one, or you can get them separate. I look at those products as being wellness products, because with the vision, I go once a year, get my eyes checked. They take pictures of everything, and they can kind of really tell what's going on with my health. But I go to the dentist every 6 months for a cleaning and things like that, and they can tell or detect any types of changes in health. Now, a friend of mine has a dentist that's a good friend of his, was telling him that, out of all the patients and everything that he sees, it's about 1 out of 5 people that he sees that he refers him back to go see their doctor. Something's going on, about 1 out of 5. That's pretty high. So it's a good way to get that checked out through the year. And with the Prime DVH, you don't have a deductible. You can go in there and get your cleanings and checkups. It works great. Now, HospitalWise, this is a good one because a lot of people have high deductible plans, and the HospitalWise, it's going to go issue ages 0 to 90. Now, I know that you're not going to have a lot of people 85 working, but you're going to have all your employees will fit within that age range, and they're going to be able to purchase coverage that's going to fill those gaps. Guaranteed renewable, conditionally for life, premium factors, issue age, unisex, unismoke. We don't have male, female, tobacco, non-tobacco. There's been studies done that it's amazing that we went to unismoke rates because our own employees years ago, we had like 99% of the employee spouses never smoked, at least on the app. But when we did the real survey and had to go to Quest to get the blood drawn, it was amazing that we had quite a few smokers. So a lot of companies have gone to unismoke. Rate structure, you've got that established there. You've got your pre-X. And you see this one-time application fee of $20. When you do list bill, that $20 is removed. So you don't have that app fee. So that makes it easy for the employer to be able to start the deductions and not have to change it after a month because of that app fee. So that gets waived. That's a good deal. Underwriting is truly simplified. Hospital confinement, this is going to pay a daily benefit. So if you get hospitalized, it's going to pay so much per day, anywhere from 50 to 1,000. Right now, I see most of our agents selling the 6-day, and you're probably looking at an average of about $300 a day benefit that they're quoting and selling. Observation benefit, this is automatically built in. There's been all those stories about you had somebody go to the emergency room and they waited and waited and waited, and then all of a sudden they were dismissed to get home, and they've been there for 16 hours, whatever, and then all of a sudden they get a bill. Well, they were thinking that they were admitted, but they weren't. So now they have a bill of their own. Well, with us, we've got the observation benefit that if you're there between 12 to 24 hours and not admitted, we're going to go ahead and pay you a daily benefit. So that helps with that. Mental and nervous, built in, at least for 7 days for observation. I worked on a claim where a young lady attempted some things and ended up having to go through the observation. Her parents were grateful for that because it helped pay. They forgot about that benefit, but it helped pay the cost that they incurred. Made that family situation that much better. Now, lump sum hospital confinement. I'm seeing more agents will quote this at a higher amount and go less on the daily. So this pays once per year. We know the hospital stays are not as long as they used to be. So a lot of agents will pump this up so that if they're in the hospital for one night, admitted for 1 day, we'll pay that lump sum benefit. Outpatient surgery, this is a good one to have. And then skilled nursing, most of the people are collecting that 21 to 100 is what they're quoting. That's because of Medicare and Medicare Advantage plans. It gives that 20 days. So that's where we're at. But you know what? It's optional. You don't have to have it if you don't want it. And then the emergency care, anywhere from 100 to 500, you don't have to be hospitalized. And then ambulance, anywhere from 100 to 500, but you have to be hospitalized. It just can't be a taxi service to the hospital and back. You need to be hospitalized for that benefit to be paid. And then outpatient major diagnostic, it's going to help pay when you have those tests, the CAT scans, the MRIs, those types of things. Now, the next product that I really like, and especially for families with children, is the accident companion. And this is a good one for employees also, especially like maybe in the landscaping or tree trimming, lawn care. These individual employees, they're working around machinery and they might get hurt at work, whatever. But if they have to go to the emergency room and, they need stitches or blow out a knee, well, they're going to have some type of payment. So with accident companion, you've got 4 options there. $2,500 hospital confinement that pays once per year, clear up to $10,000. And the emergency treatment, if you go to the urgent care center, those types of things, we'll go ahead and pay that. And that's the emergency treatment. And we'll pay that more than once per year. We'll pay that per emergency. And then major diagnostic exam, 1 per year. So that MRI or anything that's going to be done, we'll do that. And then follow-up treatment, you've got so much paid per treatment. And then physical therapy. Now the premiums go from $750 up to $28, option 4. Now I've seen quite a few claims on this policy, the hospital confinement, with the $10,000 payment on children from, football injuries, concussions, being overnight in the hospital, from car accidents, teenagers. So this is a good plan to have. And also as an employee, if you have to go to the urgent care center, you're going to be able to get something paid. Even though it might be a workers' comp claim, it's not going to help pay your deductible and all that. So this is a good plan to think about. Now, Prime VVH, that's the dental vision hearing. This plan, you've got really the focus on this is wellness. You've got anywhere from $1,000 to $2,000. So you got $1,000, $1,500, and $2,000 benefit. So it's, good, better, best, low, medium, high, plan A, B, C, whatever that you want to show there. But our traditional dental plan is a $1,200 benefit. But you look at this, you've got the choice. You have a $100 deductible per person per year, but you're not going to have the deductible on the preventive or the vision or the hearing exam. So you can purchase this today and go in tomorrow. There's no waiting period on that. And what's nice about this is that you can go anywhere you want. You're not tied to a network. Now, you're going to go to the network True Hearing for the hearing aids because of the discount that you're going to receive and things, but you can go anywhere you want. We're having a lot of success in small communities that have small businesses because a lot of times the dentist doesn't belong in a network because they don't need to. If you're the only dentist in town and people, at least here in Nebraska, you might have to drive 100 miles to get to the next community. Well, they don't really need to be in a network. So this way you can get your full benefit paid. So you got a lot of flexibility. You don't have to hunt for somebody that's in the network. You can go wherever you want, use your current dentist, whatever. Now, preventive, that's type 1. Once every 6 months, oral evaluations and reevaluations. Basic dental, type 2, that's the fillings and the x-rays. And then major, that's the stuff that I think hurts. Because you'll find out that if somebody has dental insurance and they're going on a regular basis, every 6 months, a lot of this, you're going to have some of this, but it's going to be caught up early. So think of that wellness. Now, preventive, there's no waiting period, coverage amount 100%. Basic, type 2, that's the fillings and things. no waiting period, and you can see what percentage it pays. So the longer you have this plan, the more it's going to pay. You're going to have the $100 deductible. And then major, the big stuff, you got a 9-month wait. Most of my competition has a 12-month wait. So that makes it easier on that 9-month. Hearing, you got the exam, purchase of hearing aids, anything there. But the big thing with the hearing benefit is the savings that you get by going through hearing. Now, hearing aids, those are getting pretty complex and pretty expensive. I have a family member who has hearing aids, and the amount that he pays for those is significant. So it's a nice benefit to have. And then the vision benefits, comprehensive eye exams, contact lenses, frames. You've got all that available to you. And you can go anywhere. You don't have to use iMed or Carrington like we do on our standalone plans. You can pick and choose where you go. And then follow-up visits. Cancer-wise or critical illness, you're looking at cancer-wise plus heart-wise product details. This pays a lump sum benefit based upon first diagnosis. So if you have a heart attack, stroke, or cancer, you're going to be able to pay that. Now, if you're less than 64 or 60, if you're up to age 64, you can have a guaranteed issue amount of $5,000 or $10,000. So that works well. So before you turn 64, make sure that you get the guaranteed issue amount on the application. Let's say that you ask for 50, but you don't qualify. We'll go ahead and issue 10. So it makes it work well. That way, at least it's going to be billable, and the individual is going to have something. Age-based benefit reductions, we don't have any of those. Many of the critical illness plans, when you hit 70, 75 years old, the benefit cuts in half, but the premium doesn't change, but the benefit goes down. With us, your premium stays the same and no benefit reduction. And you can see the factors that we use when we quote it. Issue age, sex distinct, unit smoke, and it's a per rate per individual depending on their age. Application fee, if it's done on list bill, that application fee is gone. Now with this product, you can build it any way you want. And I know that, as grown up, we all have kids or we all have ourselves, we mess with Legos and you can build a lot of things. Well, with this, you've got the flexibility to build it the way you want. You start with a base policy and then you have the optional rider. So you can start with cancer and then you can add the heart, stroke, or critical conditions. Or you can start with HeartWise and add critical conditions. So you can pick and choose what you want. I'm starting to see a lot of individuals purchase just CancerWise by itself. It keeps the premium affordable, and that seems to be where people focus because we all know somebody who's had cancer. And so it's going to pay that lump sum benefit directly to you. And I really look at that as income replacement. Maybe you might want to cover 6 months of salary, 9 months of salary. So you can do that and have a tax-free benefit. Now, to get started, you got to be appointed with SureBridge, and you can do that all through Messer Financial. We bring no agents direct to do business with us. We do it all through marketing organizations like Messer Financial, and they will be glad to help get you appointed and get you started. So once you get appointed with us, you get a production number, and it's going to direct you to the SUPS portal. It takes probably an average of about 5 days to get your appointment active. It'll vary from state to state. With COVID, it's kind of slowed some of the things down, but all in all, we're getting people appointed very quickly. I recommend that you get appointed now and get all your work done up front. So when open enrollment comes, you're ready to go instead of everybody trying to go through that door at that same time. Start getting prepared, go early. So once you get appointed with us, you're going to go to SUP's portal. That's the dashboard that you go to do business with us. So when you're on that dashboard, you sign into supsportal.com, you're going to look on the home page and you're going to see where it says Employer List Bill Enrollment. This is where you go to establish the list bill. Now, like I said, everything is electronic and it's going to generate everything to establish it. What you're doing here is we're trying to get that account number set up so when you get ready to do the enrollment and the application process, that account number is very important because that's what you're going to put on the app. And that's going to waive that $20 fee and it's going to put it onto the bill to be sent to the employer. So you want to go to the Employer List Bill Enrollment button right there on the front page. You can't miss it. Now, what's going to happen is when you enroll a new employer, the process begins when the agent sends an email to the employer. The email contains a link and temporary password for the employer to access the list bill tool and configure the Your List Bill account. So as an agent, you're going to have an account with all your list bill cases listed. But first of all, you got to send that link to the employer so that they can be able to start sending in the correct data so we can set up the payment mechanism. So what happens here is that you're going to have to register. It's, it's the normal stuff, the company name, address, phone, physical address. We're going to gather all that information, and that's what the employer is putting in when they're setting this up. Save and continue. And now the bill payment. This is important. You can do auto pay, or you can click on it that says, hey, send me the bill, I'll review it, and then I'll pay it. But we can do auto pay, and you, the employer, can go in there and check and see. Now it can either be paid through a credit card or bank draft. So they can set that up. And it can either be auto pay or I want to sign in and pay my bill online each month. So you can do it that way. Now, set up account administrators. Well, the payroll clerk, the individual who handles payroll at the business, HR, whoever handles all that, you can set it up so that there's an administrator who can go in on the company's behalf and do the work, because a lot of times the owner's not going to be able to do it. But, in some of these small businesses that might have 9 employees or 7, they might be doing it, through Quicken Books or whatever. But you set up the administrators. The final piece of information required is for the employer to review and sign. And really what this is that they're agreeing to deduct the money out of the employee's check. They're not giving any contribution, and they're going to send that money to the insurance company so that all these plans stay in force in a timely manner. And there's what the employer list bill agreement form looks like. It's going to have the name and address and all that information that we gathered. It's going to have the administrator, all that billing information, how it's going to be paid, and then the signature of that they're agreeing to deduct the money and send us the check to pay for the coverage. Now, the employer gets back an email once all that's completed, and they get back, and this is what's important, this list bill number. And as an agent, you will have that. That is so when you do the enrollment process, that's what you put on the application on the payment page. That way we know that that goes to that bill. And so it will coordinate it, and it will create the bill, and it will send it to the employer. Now, when we do the list bill, we really want to be careful when we do our enrollment strategy, because we have certain dates that we got to hit so that all the policies have the same effective date. And all effective dates are going to be the first of the month. So when we take a look at that, process begins with the agent sends an email to the employer. We've got that. The email contains a link. We got that. Oops, something got duplicated here. Let me get past this. Now, as the employer, you're going to sign into the list build tool by going to this email address, https://employer.surebridgeinsurance.com, and you're going to sign in as the employer. Or you can go in and sign in as the agent. This is going to show you your entire block of business. So you can go in and see each one of your accounts. And you're going to have a password and a user ID. And you create those, like the many passwords and user IDs that we have. It's tough to keep up with them all, but you're going to have to create one. And I'm sure you have a system to manage that. Then, when you get on there as an agent or the employer, he's going to be there on the main screen and the list bill. He can drop down and see everything, or he can look at all the pictures and go to the categories by clicking on these various boxes. And they can manage the bill, and that's where they can approve it and pay it. They can manage the account. They're doing some changes there. Or they can manage employees. Maybe they need to drop somebody. Somebody's left their employment. They need to drop them off the bill. Then we know that we need to send out a letter to the employee that they can still keep their coverage. It's just going to be on automatic pay, bank draft, and not through the employer. And any questions that they might have. This number, if there's ever a problem, they can call that sales support line, and somebody will gladly assist them in making sure that they keep this all set up properly. But that's for the employer to sign in and be able to pay everything. Now, once you go to do the enrollment, and if you're doing SureBridge products on an individual basis, it's going to be the same application, same process for enrolling an employee. But when you get down to the initial payment, it's going to be list bill. And so when you click on the list bill box, billing frequency is going to change to monthly, and that $20 application fee is going to go away. You're not going to have that. It'll still show up on the slide, but when the bill comes, there will be no $20 app fee. So take a look here, the effective date. Now this is important. So when you're doing the enrollment, if the current date is May 14th, like the thing, they're saying employees should select July 1st. June 1st is an option. If the current date is May 19th, employees may select July 1st or August 1st. So it's really like the 1st to the 13th of the month. They say the 1st to the 15th. I would say the 1st to the 13th of July, you're going to have an August 1st effective date. If you're going from like the 14th to the 30th, you're going to have a September effective date. So what I recommend is if you're doing employee interviews, try to do them all in the same time window so that they all have the same 1st of the month effective date. So watch that. Now, if you have a couple that straggle over into the other enrollment period, let us know and we can get that adjusted. But really try to get the bulk of them all in one employment window, sign-up window. Now, when we take a look at this, there you're going to enter your list bill ID, locate your employer as an agent. You're going to be able to manage your bills, your cases. And then the employee signs a list bill that says, hey, deduct the money out of my check. And this authorizes the employer to deduct the money out for those coverages. Now, how do I access the SureBridge Employer List Bill portal? Well, you need to be appointed with SureBridge through Master Financial, and you go into that employer, SureBridgeInsurance.com. So you have access. That's the dashboard for doing those cases. And these are the questions that we get every day. Who do I contact if I have trouble? We talked about that, the email address, and then we also have the 800 number that you can call for producer support to help get these established. And then how's the employer access the list bill? The employer has their portal that they go to. They've set up their password. And you have to do a lot of coordination between the employer and the payroll clerk, the individual, to do that. And then how can an employer do through the list bill portal? They can do a lot of things where we talked about those boxes. They can manage their case. They can set or change a list bill administrator. Mr. Accountant left and now there's a new accountant who's going to be the administrator. You can change all that. You can look at any type of past bills. You can change payment, remove employees, update addresses. You can do all that. And we're all getting used to that with everything that we're doing now online, with all of our banking, trading accounts, everything. We have the ability to update and stay current. Now, what effective date options? This is what I was talking about. Applications submitted 5/1 through 5/10 receive a 6/1. Applications submitted 5/11 through 5/31 receive a 7/1. Just try to make sure you get all the employees in one enrollment window. So you kind of got to do a lot of planning to make sure it works. It's just going to make it a lot easier, because you'd hate to have somebody that bought the accident companion and they had a 6/1 effective date, and then you had another employee that enrolled later, but all of a sudden had a 7/1, thinking that, hey, all the employees had a 6/1, he had an accident before 7/1, now he receives no payment because his effective date was 7/1. Always make sure everybody's the same to eliminate a lot of problems. So how do they pay it? Like I said, it can either be bank draft or it can be paper check. We'll send out a bill and they can send out a paper check. They can do that. And then the bill every month, they can either approve it or not. They're not required. It just depends if you have the automatic payment. It can be taken care of, because a lot of them, some of these small employers, they have very low turnover, so the bill just doesn't change. So that kind of helps you select the employers you want to do business with. Now, what happens if the employer doesn't pay the list bill? Well, the policies will go into a lapse status and we'll remove them, and we will go ahead and send out notification to the employer and the employee when the policies are delisted, and then the employee has the ability to start their own payment through their own bank draft, and they can start paying those. That way they can keep their coverage in force. They don't have to worry about contestability periods, things like that. They have no lapse in coverage. It's very important. Now, does having a policy as part of a list bill give an employer access? No, we got HIPAA. They're not going to have any idea about any type of health information. Can the employer make changes to the employee's policy? No. The only time they can change is if they delist them, but they can't change the coverage or anything. And they can remove an employee if they change employment. Now, and then how do employees sign up for insurance plans? Well, if you have a great relationship with that current business owner and the administrator, when they hire somebody new, they're going to tell you, or you follow up with that employer, make sure everything's going well, everything's working like it's supposed to, and then ask, do you have any new employees I need to talk to? And they will refer you to them. So that way you're always getting some new prospects as this business is growing, that you can be able to sell, counsel, be an advisor to, providing the correct insurance. Well, What if the employee wants to cancel their policies? They can call in and do it, or they talk to the employer and say, delist me and cancel. They can do that. But I'll tell you what, most employees that purchase on a payroll deduction basis will have a tendency to keep those policies on the books. It's like I said, they're going to be able to live on what they're taking home, and they don't seem to miss that money. It's much easier for an employee to pay so much per week deducted out of their check than to pay one monthly amount at one time. It's easier to pay $5 a week than $20 a month. Still have the same thing here, but it's just the convenience that makes this work. Now, as a recap, I always like to try to keep my webinars about 45 minutes. I always like them, short enough to be interesting and long enough to cover the subject, just to whet the appetite to get you to take a look at this marketplace. As an agent, you interact with small business owners every day. We're all doing that. Now, some of the businesses that we interact with are very large, but for the most part, we interact with a lot of small businesses. The employer and the employee and you, everybody benefits with a payroll deduction list bill case because you're able to attract and retain your employees. The employee is getting coverage that's going to protect them in the event they have something happen to them. And it makes the employer look good that, you know what, I trust my insurance agent to talk to my employees. I value their experience and their knowledge and what they're doing. So at SureBridge, we make it very easy to get started. We have a lot of training tools out there under the SureBridge University that you can check out in the process. And you can also call your sales director. So that's kind of the recap there. So the call to action. What are we going to do? Well, first of all, you want to make sure it's your appointment. So you're going to be talking to Messer Financial, and make sure you're appointed and active and ready to go. As an agent, you want to review your current client base. Kind of think of like, I could say Rolodex or file cabinet. A lot of people right now not for sure what a Rolodex is, and a lot of people, they don't have the massive file cabinet in their office. Everything's usually on a computer. But go ahead and review your current client base. Look for, who does some of your individual plans that you sold to clients, who do they work for? Or maybe they own a business themselves. Kind of do that. Another one, as I always refer to, is follow your checkbook. Who do you do business with? I mean, like I've got, the carpenter that's working on my house, Ken the carpenter. If I was selling, he's going to be one of my prospects. So this is where I'm writing a check to. Make a list of 10 businesses to approach. Kind of get them in your mind. Who do I want to approach? Some of these small communities, you might be looking at, a small restaurant. You might be looking at a hairdresser, cosmetologist, barber. Might look at the landscaping company, the people that are coming down the block doing all the mowing and things like that. You might look for, somebody that's painting the house, those types of businesses. Make a list of 10. Write them down. Review current plans. Take a look at our portfolio. Get comfortable with the plans. If I was working with a painting company, I'd be looking at that accident companion. Or a roofer, I'd be looking at the accident companion. People fall off ladders, people fall off roofs. They're going to be going to those urgent care centers. So I would take a look at that. And those are businesses that a lot of people are not calling on, but the accident plans make sense. So I've kind of developed my sales strategy with that. And if you want counseling to help with that and assist with that, you can contact Messer, or Messer will have you contact me. And you can call me anytime on my cell. I work out of my office, and there's the email address that you can send that to, or you can call me. I'll give you my number. It's 402 679-7483. And I would be glad to assist you in getting set up. Again, I want to thank you for taking the time out of your day. We're about 45, 48 minutes into this. I appreciate your time, and I look forward to assisting you in getting your first case going before open enrollment starts. This is a daytime activity, and think about those small businesses. And I challenge you to go out and write one, because usually we're about 7 lives, and that's pretty favorable annual premium, plus commissions are very favorable on list bill. So again, I'm going to turn it back to Messer, and I appreciate them setting this all up and getting everybody on board for this.
Hey, thanks, Jesse.
Yes.
We have a one or two questions.
Okay.
What constitutes an emergency treatment?
It's going to be within 72 hours, and it's going to be due to an accident that you're going to go. I can get the exact definition, but it's going to be, something that wasn't planned, and away you need to go to the urgent care center. But I can get the exact definition and send it to you, and that's in the policy. But it's something that, it happened. Truly an accident.
Do you mind sharing the slideshow, the slide deck?
No, I have no problem. I'll send you the slide deck to you.
Okay. When Jesse sends me the slide deck, I will forward it out to the agents. And what's your phone number again?
The phone number is 402-679-7483. I thought I had it on there. I guess I need to update the slide.
Yeah, and what I'll do is I'll send his contact information when I send out the follow-up for the webinar.
All right.
All right. Thanks again, everybody, for attending, and thank you, Jesse, for participating. You always give great webinars. We like partnering with you in SureBridge.
All right, guys. You have a great day, and stay safe. And let's see if we can get a couple cases on the books. Take care.
You too. Thanks, everybody. Have a good one.